Dear friends, today I am going to discuss an article by Patton CM on conflict in healthcare, a literature review. It can be found in the Internet Journal of Healthcare Administration, 2014, volume 9, number 1. The purpose of this literature review is to offer an overview of the antecedents effect of conflict among healthcare workers. Both the positive and negative effects of conflict are addressed. Also explored in this review are the methods in which negative conflict can be adequately managed and resolved. So, what is conflict? Conflict is described as a process by which one party perceives that its interests are being opposed or negatively affected by another party. To the dynamics of the conflict, conflict is a complex behavior. It can occur at various levels. It can be interpersonal, intergroup, intra-group, and according to the definition of conflict, we know that perception plays a very important role. Research indicates that prolonged unresolved conflict is dysfunctional and can hinder organizational performance. The total avoidance of conflict but is more of a fairy tale than a realistic expectation. There seemed to be a difference of opinion between Haraway in 2005, who suggests that leaders not to try to eliminate conflict, while Durgan and Mulkey in 1996 argue that conflict is always the goal. Traditionally, since the 1930s, conflict was viewed as destructive, dysfunctional and disruptive, and was something to be suppressed or eliminated. Only later in 1956, Koser noted that the positive effects of conflict. Since the 1930s, conflict was viewed as disruptive, dysfunctional and destructive and was thought of as something to be suppressed or eliminated. But much later, in 1956, Koser noted the positive effects of conflict. Some effects of conflict may be positive. In 2006, Almost has said that reasonable degrees of conflict can lead to the generation of ideas and foster team cohesion. Once conflict is resolved, those involved in the conflict feel more united and capable. So now let's discuss what impact does conflict have on a patient and a provider. There can be delays or inadequacies in patient care caused by a provider refusing to consult because of some unresolved past conflict. Conflict is associated with high job turnover, decreased job commitment, absenteeism, increase in grievances, and consideration of leaving the profession among the providers. Interpersonal conflict has been noted as one of the major sources of stress, which can produce psychosomatic illnesses and can eventually undermine an individual's self-esteem and confidence level. So what are the antecedents of conflict? Personality, values, and expectation difference can all cause interpersonal conflict between healthcare workers. Blurred job boundaries and decision-making disagreements, those between advanced nurse practitioners and doctors, are problematic and conflict-inducing. Communication, whether it's verbal, non-verbal, or lacking, can result in negative conflict. Competition among departments while battling for resources and the complexity of the organization are also antecedents of healthcare conflict at a macro level. Okay, so that leads us to conflict management and resolution. There are 5 styles of handling conflict according to Rahim and Bonoma model: avoidance, compromise, obliging, dominating, and integrating are the types. Avoidance and compromise are common styles used by physicians and nurses. While dealing with complex issues, the preferred style of conflict handling is integrating. In order to resolve conflict, managers must first identify the source of conflict by engaging in careful listening. Wright and Ketledieu in 2011 recommend that nurses and physicians should undergo conflict management, resolution education, and interpersonal skills training. An interesting observation from OCMIB in 2006 is that it is important to recruit more females in medical education and more males in nursing field so that it can reduce the gender role perception-based conflict and enhance nurses-doctors working relationship. So we have lot of theories related to conflict and its management. What are its limitations and what are the research needs for the future? There remains a large gap in literature regarding healthcare professionals' conflict resolution training. So now let's discuss the implications of conflict on the healthcare worker at the workplace in future. The job demands and work pressure on healthcare workers are bound to increase significantly. It's twofold. One, due to the Obamacare or PPACA allows for more Americans to receive health coverage. Therefore, we expect more or the increasing number of patients in healthcare facilities. Second, the aging baby boomers generation will start to experience decline in health and thus require more frequent healthcare visits. So I think it would be fitting to conclude that functional conflict can help an organization make necessary changes, while dysfunctional conflict bears negative impact. It can lead to medical errors, job dissatisfaction, stress, and related psychosomatic illnesses, decreased productivity, poor employee retention, and lack of collaboration. Though elimination of dysfunctional conflict in the healthcare field is impossible, managers should keep themselves aware of work dynamics and address negative conflict as soon as it is recognized. So, in order to mitigate these effects and for effective conflict resolution, educating healthcare workers about different types of conflict and the methods of conflict resolution is recommended. So before we end the discussion for the day, may I leave you with a few questions to think about. So question number 1. What are some of the strategies that can be utilized in order to manage and resolve unhealthy conflict within the healthcare system? Question 2. How can conflict lead to a sharpening of critical issues and catalyze important changes that benefit the organization as suggested by Haraway and Haraway? Question number 3. What is your take on this novel idea by Okbimi to help resolve the problems of physician-nurse conflict by recruiting more males in the nursing field and more females in the medical education? Hope this session had been informative. Thank you for your patient listening.